you asked me a question about milk and anemia. It's a very, very broad question. So we have to go according to ages and stages. That is the best way in any aspect of pediatrics. Normal human breast milk is low in iron content, but the iron in breast milk is absorbed best and most. Whatever iron is there in human breast milk, mother's milk we will call it. In intrauterine life, iron, B12, folic acid are stored so that by the time child starts weaning, 6 months or so, the iron stores should last and should not cause anemia. That is the arrangement of the nature, normal arrangement of the nature. Iron deficient mother does not cause iron deficiency in fetus and iron deficiency at birth. Fetus is a parasite. He makes mother more anemic and absorbs the iron from mother. So iron deficiency prevention, B12 deficiency, folic acid deficiency prevention in mother is important for mother's health. But at birth there are sufficient iron stores. In prematures, most of the iron storage occurs in third trimester and in later pregnancy. So even 15 days, 1 month premature born before will be deficient. The stores will be less. So we get anemia of prematurity. That is the pathophysiology of anemia of prematurity. And that's why iron supplements are required and recommended in normal children after 1.5 months and prematures after 10 days or since birth. The prophylactic dose of iron is 1 milligram per kilogram to prevent anemia, iron deficiency anemia. 1 milligram is 1 drop. So we have to calculate dose of prophylactic iron, preventive dose is 1 milligram per kilogram. Delayed weaning, dirty dilute formulas, inadequate iron content in the weaning food, B12 and folic acid content in the weaning food is next common cause of nutritional anemia, and that is because of milk. Cow's milk or buffalo's milk or any animal milk is low in iron. and so they are more prone for anemia. So we have, if there is animal milk is not recommended as a weaning food. Weaning is always with semi-solid. There is no place for animal milk in weaning food. Weaning food has to be semi-solid. Has to be a mixture of rice, dal, sabji, pal, so that the anemia is prevented. Overconsumption of animal milk is the major national problem of infancy. No animal consumes other animals' milk other than human being. Human babies are fed cow's milk, buffalo's milk, camel's milk, goat's milk, and whatnot. They are not made for each other. It's a wrong diet. Animal milk is a wrong diet. Faulty feeding technique. Diagnosis is faulty feeding technique. What is wrong? It causes iron deficiency anemia, it causes starvation, it causes malnutrition. Milk, animal milk itself is a liquid diet. It contains 2% solid, 98% liquids. Cow's milk, buffalo's milk, animal milk protein can cause animal protein milk allergy, cow's milk protein allergy. It is manifested as insensible blood loss through the stool. It is not visible. It is not visible blood loss. But there is a blood loss. So low iron intake compounded with macroscopic blood loss throughout the intestine due to animal milk protein allergy is a grand stage for iron deficiency anemia to manifest. So we have to be very, very strongly against animal milk consumption, and using animal milk as a substitute to cow's mother's milk or substitute to weaning foods, which should be semi-solid. We see children consuming liters of animal milk. Bottle feeding comes along with lot of animal milk feeding. They are comorbidities of infancy. Faulty feeding techniques. Diagnosis is faulty feeding techniques, and prevention, telling the mother that this mistake you are not supposed to do. If you do this mistake, your child will be suffering from anemia and malnutrition, and he will not grow well. His brain will not grow well. He will not get even adequate proteins, which are very important for brain growth below 2 years of age. So dirty dilute formulas Children who consume lot of animal milk are anemic, constipated, cranky, irritable. A properly weaned child grows well, develops well, and does not get anemia. Goat's milk is deficient in folic acid. Some communities, goats are very important. शादी में लड़की के साथ एक या दो गोट देने की प्रथा है, सो दैट उसको बच्चे हो गए तो उसको गोट्स मिल्क मिल जाएगा. But goat's milk is folic acid deficient. It is not recommended. Even if it is given, we have to supplement it. Supplement oral folic acid, B complex, and iron. So in general, anemia due to milk is a preventable and custom oriented problem of infancy. Mother's education, health education, awareness of the complications of animal milk consumption are preventive steps, and they are very useful.